Welcome to the deep dive. Today we're tackling a really important topic, especially if you share your life with a dog or a cat. We're talking about insulinoma.
That's right.
We've got some excellent detailed information, mainly drawing from canine and feline insulinoma, and we're really going to unpack it.
Yeah, dig into it.
Our goal really is to get a solid understanding of this condition, what it actually means for our animals, and what are the key things you need to keep in mind.
So basically what we're looking at here is a functional tumor. It develops in the pancreas, specifically in what are called the beta cells.
Okay, beta cells.
Yeah, think of them like tiny insulin factories. Normally they release insulin based on blood sugar, right? But with this tumor, the factory, it just goes into overdrive.
Yep.
It pumps out way, way too much insulin, and it doesn't really care what the blood sugar levels are doing.
Okay, let's pause on that functional tumor bit. So it's not just a lump, it's actively doing something. Like you said, overproducing insulin.
Exactly, like a factory switch that's stuck out. It just keeps churning out insulin, need it or not.
And that flood of insulin, that's the core issue,
That's the central problem, yes. It leads directly to hypoglycemia.
which is low blood sugar.
Abnormally low blood sugar, yeah. And glucose, that's the body's main fuel, especially, for the nervous system. So when levels drop too low, well, that's when you see serious issues start to pop up.
And it's not just one system that gets hit, is it? Our sources mention the nervous system, obviously, but there are other effects too.
Oh, absolutely. The nervous system signs are often the most dramatic. Things like seizures, disorientation, maybe weird behavior changes, even collapse.
Scary stuff.
Definitely.
Mm-hmm.
But you can also see effects on the musculoskeletal system, like general weakness or maybe muscle twitching.
Right.
And interestingly, some animals, especially dogs, might actually develop an increased appetite and gain weight.
Wait, gain weight, that sounds wrong. With low blood sugar.
It does seem counterintuitive, doesn't it?
Yeah, you'd think the opposite, weight loss. So what's happening there? Is the body just desperately trying to get one fuel, but it can't use it right?
It's likely a mix of things. That extra insulin is super efficient at shoving glucose into cells, so the body might, perceive a need for more fuel. Plus, there are probably hormonal signals kicking in as the body tries to compensate. It's complex.
Okay.
Now, it's worth saying, while this can happen in both dogs and cats, it's actually considered uncommon in dogs and pretty rare in cats.
Right. So good to be aware, but maybe not something every owner will encounter. Are there specific breeds or ages that are more at risk?
Yeah, there are. In dogs, we definitely see some breeds pop up more often in the reports. Labs, standard poodles, boxers, fox terriers, Irish setters, German shepherds, Goldens, collies too. They're all mentioned.
Huh, quite a list.
It is. For cats, the link isn't as strong. There have been some suggestions, maybe with Siamese cats, but it's not nearly as clear-cut as it is with those dog breeds.
That's interesting about the dogs. Makes you wonder about genetics, doesn't it? Like maybe something breeders should track. And when does this typically show up? Is it an older animal thing?
Typically, yes. Middle-aged to older pets. For dogs, the average age seems to be around 10 years, but the range is pretty wide, like 3 up to 14 years old.
Wow, starting as young as 3.
It can happen. Cats tend to be diagnosed even older, though. Average around 15 years, maybe ranging from 12 to 17.
Okay, so definitely something to keep in the back of your mind if you have, say, an older lab or a senior cat. Now, you mentioned the signs can be episodic. What does that actually look like for an owner?
It means the symptoms aren't necessarily constant. Your dog might have, say, a seizure one day, but then seem totally fine for days or weeks. And these episodes, they might seem random, or they might seem linked to things like missing a meal or getting really excited or exercise. Even eating, sometimes.
We'll come back to the eating thing.
Yeah, but the key point from our sources, especially for dogs, is that you often see multiple signs stacking up over time, and they tend to gradually get worse.
So what specific things might an owner see? Looking back, what could be a red flag in their dog's history?
Well, the most common thing reported is seizures. Either, full body, generalized seizures, or maybe just focal ones, like twitching in one area.
Okay.
But honestly, there's a whole list. General weakness is big. Sometimes it's specifically hind limb weakness, collapse episodes, muscle twitching, like we said. Just odd behaviors, things that seem out of character, maybe described as bizarre. Lethargy, depression, just not being themselves.
Right.
Lack of coordination, stumbling, balance issues, that increased appetite we mentioned, sometimes really noticeable, weight gain. And sometimes increased drinking and urination, plus finding they just can't exercise like they used to. It's a mixed bag, which makes it tough.
Definitely sounds tricky. And for cats, Are the signs similar, or are there key differences cat owners should look out for?
There's definitely overlap, but some important differences too. Seizures and lack of coordination, you see those in cats as well. Muscle twitching, weakness, lethargy, depression, those are common too. But, and this is a key difference, cats with insulinoma might actually show a loss of appetite and weight loss. They might still drink more though.
Huh. So dogs might gain weight, cats might lose it. That really shows how the same underlying problem can manifest differently across species. What about at the vet's office? During a regular checkup, would a vet likely pick up on physical signs?
You know, often the physical exam can be completely normal, especially if the animal isn't actually having a hypoglycemic episode right then and there.
Okay.
Obesity can be a finding, especially in dogs, like we talked about. And in rare cases, dogs might show some neurological deficits on exam, like muscle weakness, maybe even progressing towards paralysis, muscle wasting, reduced reflexes, but that's less common.
So it sounds like just relying on the routine physical might not catch this early. That episodic nature really complicates things.
It absolutely does.
Let's dig into the cause. What's actually triggering this uncontrolled insulin release in most cases?
In the vast majority, for both species, the culprit is a single cancerous tumor, usually a carcinoma or an adenocarcinoma. It's a tumor of those specific insulin-making beta cells in the pancreas.
The answer is usually.
Sometimes it can be a benign tumor called an adenoma. But even those, particularly in dogs, have the potential to spread, to metastasize. And interestingly, in cats that are diagnosed, it seems more common to find malignant tumors that have already spread by the time they're found.
That's tough, and we touched on this, but it's so important. What are those common triggers for the low blood sugar episodes?
Right, the triggers. Fasting is a big one, which makes sense, no incoming glucose. Excitement, exercise, those burn glucose faster. But here's the really tricky one, the one that confuses people. Eating. Eating can sometimes trigger an episode.
That still blows my mind. How can eating, which should give energy, actually cause low blood sugar?
Yeah, it feels completely backward. The thinking is, when an animal with this tumor eats, the food intake stimulates those already overactive tumor cells. So they release an even bigger, uncontrolled surge of insulin in response to the meal. This massive insulin spike just pulls glucose out of the blood way too fast, and the blood sugar level crashes, sometimes even lower than it was before they ate.
Oh.
It's a really critical point for owners to understand these episodes aren't just about skipping meals.
That's vital information.
Yeah.
Okay, so given these varied signs, the intermittent nature, these weird triggers, how do vets actually diagnose insulinoma? It sounds like detective work.
It often feels that way, yeah. The process usually starts by ruling out other things that can cause hypoglycemia. There's actually quite a list.
Like what?
Well, other kinds of tumors can sometimes release insulin-like substances. Accidental ingestion, maybe getting into human diabetes meds or insulin. Liver failure is a big one. Severe infections, sepsis, problems with the adrenal glands like Addison's disease. And in very young or small breed dogs, they can just be prone to low blood sugar sometimes. Plus, there are rare glycogen storage diseases. And if the main signs are seizures or collapse, you also have to think about heart problems, other metabolic issues, other neurological diseases. So yeah, it's definitely a process of elimination first.
A lot to rule out. What about just standard blood tests? Can those give a clear answer?
Routine blood work might actually look surprisingly normal, except for finding that low blood glucose, usually like below 65 or 70 milligrams per deciliter.
Yeah.
But, and this is crucial for you to understand, a single normal blood glucose reading does not rule out insulinoma.
Because it fluctuates.
Exactly. The levels can swing quite a bit, partly because the body tries to fight back against the low sugar by releasing other hormones, things like epinephrine, cortisol, glucagon. These can temporarily bump the sugar levels back up.
Right, the body's trying to compensate. So a single snapshot might miss the problem. Which brings us to those simultaneous fasting glucose and insulin tests our sources mentioned. Can you walk us through that? Why is it better?
Okay, so this test is specifically designed to catch the tumor inappropriately releasing insulin when the blood sugar is already low. It usually means hospitalizing the pet for close monitoring.
Because fasting could trigger a crash.
Precisely. So they start with a baseline blood sample. Then, while the animal fasts, they take blood samples periodically just to track the glucose level. The key moment is when the glucose drops below a certain point, often around 60 milli-GDL. At that exact moment, they draw another sample specifically to measure the insulin level.
Ah, checking them together.
Yes. If you find high insulin at the same time the glucose is low, that's really strong evidence pointing towards insulinoma. Because normally, if glucose is low, insulin should also be low.
Makes sense.
If the insulin is normal or low when the glucose is low, it suggests something else is causing the hypoglycemia. One tricky thing, though, is that insulin release from these tumors can be pulsatile.
Pulsatile.
Yeah, like it comes in bursts, not necessarily a steady stream. So sometimes you might need to take multiple samples during that low glucose period to actually catch a high insulin moment.
Okay, so you might need a few tries to catch it in the act, so to speak. What about imaging? Can X-rays or ultrasound actually show these tumors?
Imaging definitely plays a role. Chest and abdominal x-rays are good for checking for obvious spread to places like the lungs, or maybe ruling out other types of abdominal tumors. Abdominal ultrasound, well, it can sometimes see a mass in the pancreas, but honestly, reports suggest it misses them more often than it finds them, maybe less than half the time.
So not super reliable for the primary tumor itself.
Not always, no. CT scans are generally considered more sensitive, especially for finding the main tumor in dogs, but even CT isn't perfect. Sometimes it shows changes in lymph nodes that look suspicious but turn out not to be cancerous on biopsy. There are other more specialized scans like scintigraphy or SPECT scans used sometimes, and actually something called intraoperative ultrasound, using ultrasound right there during surgery, can be helpful for locating tumors that are hard to see or feel.
So imaging helps build the picture, but it's not always the final answer on its own. Sounds like sometimes you need to go in and look directly.
Exactly. If insulinoma is really high on the suspicion list, based on the signs in those glucose insulin tests, then exploratory surgery laparotomy might be the next step. It lets the surgeon directly examine the pancreas and the surrounding organs.
And that's where you get the definitive diagnosis.
Usually, yes. The gold standard is pathology. Examining tissue samples either from surgery or sometimes from a biopsy if surgery isn't done right away under a microscope. That's what confirms the type of tumor cells.
Okay, so once it's confirmed, what are the treatment strategies? It sounds like managing this must be pretty intensive.
It really requires careful management. Initial care often means hospitalization, especially around diagnosis and surgery, just because that risk of severe hypoglycemia is so high.
Right.
If an animal comes in crashing with really low blood sugar, the immediate step is giving concentrated glucose, dextrose, intravenously to stabilize them. After that, keeping them stable might involve IV fluids with glucose mixed in or feeding frequent small meals. And activity usually needs to be restricted to prevent sudden sugar drops.
And diet sounds like it's always a big part of the plan, no matter what else you do.
Absolutely. It's a cornerstone. The usual advice is frequent small meals, maybe 4 to 6 times a day. The meals should ideally be higher in protein, fat, and complex carbs, and lower in simple sugars that can cause rapid spikes and subsequent crashes.
Any foods to avoid?
Our sources specifically mention avoiding semi-moist foods. Their composition might just not be right for managing these fluctuations. And critically, owners need really good education, how to spot low blood sugar signs at home, what to do immediately, and when to get straight back to the vet.
Makes sense. What about surgery? Does removing the tumor help?
Yes, generally, surgery offers a better long-term outlook compared to just managing with medication alone when it's feasible. Before surgery, though, you need to get the animal stable medically, usually with that frequent feeding plan, maybe adding corticosteroids temporarily. The goals of the surgery itself are 1, confirm the diagnosis visually, 2, check everywhere for signs of spread, metastasis, and 3, remove as much of the tumor tissue as possible. That intraoperative ultrasound we mentioned can be really helpful here for finding small tumors.
And spread is common, right?
Unfortunately, yes. Especially in dogs, metastasis is pretty common. Maybe 40–50% of cases have some spread already. And sometimes there isn't just one tumor, there can be multiple nodules. So taking biopsies of nearby lymph nodes and any suspicious spots is really crucial, even if things look okay, to know if the cancer has spread microscopically.
So even a successful surgery might not get everything if it's already spread. What if surgery isn't an option, or if it has spread widely? Are there medications to help manage?
Yes, definitely. There are several medical options for long-term management. Glucocorticoids, like prednisone, are often used. First, they help counteract the insulin and raise blood sugar. There's a drug called diazoxide. It works by boosting glucose production by the liver and also inhibiting insulin release from the tumor. The downside is it can sometimes be hard to get and pretty expensive. Then there's streptozocin. This is actually a chemotherapy drug that specifically targets those pancreatic beta cells. But it's chemo, so it comes with risks, potential side effects like vomiting, liver, or kidney problems, even potentially causing diabetes or pancreatitis. It requires careful administration and monitoring.
Right, serious stuff.
There's also glucagon, which is a hormone that raises blood sugar, usually used for severe acute emergencies. And in really difficult cases, sometimes synthetic versions of a hormone called somatostatin, like octreotide or lanreotide, can help inhibit hormone release, including insulin, to prevent hypoglycemia.
A whole toolkit, but with trade-offs.
Exactly. And it seems obvious, but worth stating. You absolutely never give insulin to these animals. That would be disastrous.
Right, of course. So with all these options, what can owners expect long-term? How do you monitor these pets?
Long term, it's all about close monitoring by the owner. They really have to become experts at watching for any return of those low blood sugar signs. Regular blood glucose checks at home using a portable meter are often recommended and become part of the routine.
And complications.
The main complication is recurrence or worsening of the hypoglycemia, meaning the tumor is still active or has regrown or spread. Owners need to be prepared for that possibility.
And the big question, what's the prognosis, the overall outlook for dogs and cats with this?
For dogs, surgery generally gives them longer periods of being symptom-free with normal blood sugar and significantly longer overall survival times compared to just medication alone. Even if there is spread, surgically removing the bulk of the tumor, debulking it, can make medical management more effective afterwards.
Okay.
The average time they stay well controlled and how long they survive overall really depends on how advanced the disease was when it was diagnosed and treated the stage. Some more recent studies actually suggest that combining surgery with medical therapy might give the longest survival times now.
That's encouraging. What about for cats?
For cats, the prognosis tends to be, well, more guarded. The average survival time recorded is around 6.5 months, but there's a really wide range around that average. Some do better, some, unfortunately, don't make it that long.
So it really underscores how vital early detection and getting that proper veterinary care is. And surgery, especially for dogs, seems like it often gives the best shot at longer-term quality of life.
That's a great summary. Recognizing those signs, even when they're subtle or intermittent, is just so crucial. And then pursuing that thorough diagnostic workup with your vet. Insulinoma is definitely serious, no question. But understanding the options, including surgery, helps owners make the best possible decisions for their pets.
This has been really insightful, a proper deep dive into insulinoma. It's clearly a complex condition, but hopefully walking through it like this helps clarify what it is, how it affects dogs and cats, and maybe most importantly, why paying attention to those sometimes easy to miss signs is just so critical.
Absolutely. And when you think about the complex hormonal balance, that interplay between insulin and glucose that gets so disrupted here, it really makes you wonder, doesn't it? What other endocrine disorders might be out there in our pets, presenting with signs that are just as subtle or maybe even paradoxical like that eating trigger? It really highlights how important it is for us as pet owners to just be really observant, to notice those little changes that might signal something bigger is going on.